Good morning, everybody. Glad that you all are here today. The mental health ministry team, as part of FPC, was intact a number of years ago, and then it kind of waned for a while, and we began to realize how important it was to reenact it. And so we've got some really dedicated folks that have come together over the last few months to kind of figure out how we can move forward, because we've also come to understand that mental health covers a wide range of topics and ages, and that everybody has a story. And so we're so glad that you all are here today, and we're thankful that Caroline's going to be here today to lead you on. Many of you all know Caroline Phillips. She's part of our pastoral care staff. She and her husband both are Presbyterian pastors, and Caroline's also a licensed clinical social worker. So has done a fair amount of counseling work for us to have on our staff, and she's going to lead you all today. Let's open with a word of prayer. Good and gracious God, we thank you for the gift of each and every day. We thank you for the Sabbath day set apart as we come together in community to worship you. But Lord, especially today, we thank you for gathering us here together to explore the topic of mental health and what it means, oh Lord, and how we can come alongside to learn for ourselves and also to learn to support those that need most of us in our lives. Be with us now and always. In Christ's name we pray. Amen.
Thanks. Well, good to be here with all of you today, and definitely talking about a topic that I'm passionate about. As Newton said, I'm a licensed clinical social worker, and really, when I was getting my master's in social work, I was trying to figure out where I was going to do my internship, and there's just social work is such a broad range of topics, and I ended up at a community mental health center, and this is in Chicago, on the far south side, actually the south suburbs. And I really didn't know a whole lot about mental illness, and I learned so much in those years. I ended up going on and working there in community mental health for many years, and it was just such an interesting topic, and to meet these people with these stories, and a lot of those folks were folks with severe mental illness and schizophrenia, and then to kind of come full circle and now be working with folks who are on a different level, and sometimes it's just an adjustment disorder, something that's just grief, or something that's just happened in their life and they're adjusting to it, and so there's just a full spectrum, and so it's really become a topic that I'm passionate about, and also one that connects with my own story, and just having been in ministry now for many years and worked as a social worker. I actually have a therapist that I've been working with for over 10 years, so which is really awesome to have that continuity. And I think in today's world we're able to do that because of technology and all that. So it's really a blessing to be here with you all and talk about this topic, and I just want it to be an open conversation and not just me spitting numbers. I will, we'll do some facts and stuff like that to try to reduce the stigma, because that's what we're about. But please just feel free to jump in. I want this to be a conversation. So when I was thinking about a name for this, I thought, well, both head and heart. And I say that because I think with mental illness, it involves your heart. It involves emotions, it involves ones that are close to you, it involves just a lot of emotional topics. And then it's a head because sometimes it's our thinking that gets distorted, and sometimes it's about stepping back and saying, okay, what's really going on here? Because if we're in the thick of our emotions, sometimes we're not able to make the best of decisions. And so sometimes we might need either a provider or trusted friend or family member to help us make some of those decisions. But I want to start off with a little bit of a giveaway and a little game. Just one question. How often do you think mental illness is? How many adults, and this can give a percentage, or do you think experience mental illness in America every year?
Put it up in the 80% somewhere.
80%, okay. Any other guesses?
1 in 3.
1 in 3. Any other guesses? We're getting closer. And this is just what the facts are. There's probably a lot of unreported, right? But Yeah, it's actually a little bit less than a third. 25%, we're getting closer. 20%, all right. All right, well, Brenda, you get, there's a t-shirt and a bracelet back there if you want it, that you can have at the end of the year. So that's, I mean, at the end of the session, so it is actually 1 in 5. So adults experience mental illness each year. And that, like you said, I think 80% is, I get that 80%, right? Because we're all experiencing emotional moments and mental illness and I'm sure there's a lot that's underreported. So, but those are the facts that I got from the NAMI website, the National Alliance for Mental Illness. 1 in 20 US adults experience serious mental illness each year. 1 in 6 youth age 6 to 17 experience mental health disorder each year. And 50% of all lifetime mental illness begins by age 14. And 75% by age 24. And lastly, suicide is the second leading cause of death among people aged 10 to 14. And I know that's a really scary statistic to hear. For those of us who are parents of young kids, or anybody really to hear that. But I think the important thing is there is hope and people are resilient. And one of the best things that we can do in terms of decreasing all this is to talk about it, decreasing the stigma. If you know somebody who's having those thoughts about suicide, the best thing you can do is talk to them about it. Let them talk about it. Don't, have them bury it. So that's what's going to help the most. So what we're going to cover today are what are the signs and symptoms? What's therapy like? How can I help a loved one? So when might you be concerned about yourself or a loved one? In terms of mental health, what might be some of the things that kind of you think, well, maybe I'm concerned about myself or someone else?
Isolation.
Isolation, yeah.
Inability to function.
Inability to function.
Activities.
Yeah, for sure.
Changes in normal habits.
Changes in habits and just level of functioning, kind of.
They might be saying some keywords. They might be saying some keywords that, hindsight can go back and realize it.
Yeah, like what kind of keywords would you be thinking?
Yeah, they talk more about death, but they talk more about giving away their belongings.
Yeah.
It's a wide spectrum of things.
For sure. It's interesting. I had a friend in high school who actually attempted suicide and she's doing well now. But I remember coming over one day and I had been in actually, we were in college at that point. But I remember going over to her apartment and she had this pillow and I was like, oh, I love that pillow, that's so cute. And then the next time I saw her, she actually brought the pillow to me and she was giving it to me. Several months later, she ended up attempting suicide. And, I think, and I thought about it, I was like, oh, her giving this pillow away, it was almost like, yeah, was she giving that away because she was thinking she wasn't gonna be there anymore? And I think that might have been the case. And so, yeah, so those are some of the things, other things that you can think of anything in yourself that you might be concerned about, that you might want to get help. Like if something was happening out of the ordinary in your life.
Not sleeping.
Not sleeping is a big one, right? Yeah, especially if you're feeling anxious at night and that's why you're unable to sleep. Anything else you're going to think of?
Emotions that are overwhelming, whether it be anger, sadness, or
Emotions, just more frequent emotions, like
they're overwhelming.
overwhelming emotions. Yes, for sure, definitely. So there are some kind of key things that we can talk about. In terms of anxiety, I think anxiety is probably the most prevalent, most common that we see. It's about, feeling nervous, having racing thoughts, worrying about the future, panic attacks. And all of these things can be really scary. I don't know if anybody here ever had a panic attack? I know I have. And actually was taking a Greek exam in seminary. I had a panic attack while taking a Greek exam, and I just couldn't function, and it's all these things, it can be really scary, and it can be very overwhelming. Sudden mood changes, hard to name what you're feeling, hard to communicate needs, that isolation that you talked about, low moods, dips in mood, seclusion, just somebody who's just not interested, one of your family members or friends just not interested in doing some of the things they used to do. I think that's a big thing to be concerned about. They used to love, I don't know, watching NASCAR, going to NASCAR shows, and now they're not doing that anymore. And then there's also some of the more serious things like hallucinations, paranoia, and delusions. This is really like less than 1% of the population. When I worked in community mental health, it was surprising to hear to me years later that it was less than 1% of the population, because I saw so many folks who, you know, had schizophrenia and were dealing with that. But it is really a tiny percent of the population. But this can be very scary. You know, people may try to hide it or isolate themselves even more. And so just some of the things to be aware of. Some more signs and symptoms. You know, we talked about that worry, that excessive worry, feeling excessively sad or low, confused, thinking there are problems. And I think, you know, sometimes, especially if we're looking at, you know, as people get older, you know, are they confused because it's like normal aging, or is there something more going on? Because, you know, a lot of times there's been a big life change, such as retirement or something like that. You know, that can be a time where depression may have its first onset. So there's also, there's extreme mood changes when we think about mood disorders like bipolar disorder, right? Incredible uncontrollable highs or feelings of euphoria. And then there's also, like we talked about, kind of strong feelings of irritability or anger. Somebody like used to be pretty easygoing, and now you see they're just irritated all the time. That's definitely a sign. Sleep, we talked about, eating habits, difficulties understanding or relating to other people, and again, avoiding things that they used to do. Difficulty perceiving reality, again, that's more the paranoia, the hearing voices, some of those extreme symptoms for people who have psychosis. An inability to perceive changes in one's own feeling or lack of insight. So just not really in touch with what's going on. Like you see all these changes but they don't recognize them themselves. Of course, overuse of substances, physical ailments, thinking about suicide, thinking about death and talking about death. And that can be, again, a really scary topic for folks to talk about, especially if you think about kids, teenagers, and really reducing that. And I know if you haven't visited the table yet, back there is a pamphlet, and it's for the number 988. And that's a number that you can call. That's really, it's like 911, but it's dedicated to folks who are experiencing suicidal ideation or are feeling like they want to commit suicide or attempt suicide. And you can just call that number and there'll be somebody there to talk to. So I want to briefly mention that these are some of the signs and symptoms in children. And I think there's an interesting, for those who are parents or have younger, kids in your life, if you think about that tween era, that like 10, 11, 12, is kind of an interesting age group to be aware of. I was listening to a podcast yesterday, and this is a great resource for anybody who wants it. It's called Dr. Becky Good Inside. And she has, she's a child psychologist, but she was talking to a mom, and she was worried about her son, who's, I think he was like 10 or 11, and maybe 12. And, she was saying, he started middle school, he's just quiet. He's not, is he still engaging it? Is he still doing most of his sports? Yes. Was he playing? You know, all the video games that he loves to play, yes. But he was just very quiet, and she was worried that it was a sign of depression. And she kind of talked with the mom about, you know, other things going on in his life, and she was like, it sounds like it's just kind of normal tween stuff. That there's just a lot of changes that happen in that age. And you know, there are ways, she gave her kind of some tips to connect with her son. And to, you know, not to feel like the mom that's like, you know, asking all the questions and you know, but these things we worry about, right? Like we see all that kind of stuff and we're like, does this mean that they're depressed, especially when we, you know, there's so much that's changed over the years with social media and the way kids grow and learn, and they're, you know, they're growing up faster in some ways, but in other ways, their social skills are, you know, not what they used to be because they're spending most of their time communicating through text or chats. So, you know, I think it's also for just kind of specifically talking to parents who might have kids in that age group, you know, what's your support system like? Do you have other parents you can talk to? You know, can you talk to your pastor? Can you talk to other people in your life? Can you talk to the teacher? You know, and kind of to see, is this normal or is there something bigger? Because really, I think if there were bigger things going on for a kid or a tween, it would be like, they're not interested in any of their activities. They've taken a huge step back in their grades. You know, knowing with this kid, he had just started like 6th grade, which was already a big transition period. And so these are just some more of the signs and symptoms to be aware of in children. Any thoughts or reflections on that? I know that's kind of a lot to kind of unload. Yeah.
So, as somebody who works with teenagers.
Yes.
And
Yeah.
somebody who has someone who's fast approaching teenage
Yeah.
years in the household, and you see all those things. And all those things are normal.
Right.
For teenagers
Yeah.
in one sense.
But if it's like
But-
nightmares every night.
Right. I think the tension and I'd be so fascinated to hear from other parents on this. The tension is where's the line between,
Mhm.
hey, this is normal teenage stuff
Mhm.
and then something we're doing,
Yeah.
if that
Yeah.
makes sense. And I mean, it's one thing for me to, you know, work with kids for 90 minutes a day,
Mhm.
but another thing to have one of my parents.
Right, exactly. Yeah, because you can't, sometimes you can't see it as clearly when you're in it, right? Yeah. I don't know, any other thoughts, any parents have any thoughts on that, or, I mean, I think it's, you know, it becomes more extreme, the changes, big changes, not just little, because like I said, with this, the podcast I was listening to, this little boy, he had just started middle school, and it's like, you think about kids, like, are they able to know how to study when they get to middle school? Like, there's just so much that's expected of them, and there was a lot of transitions. Yeah, I mean, temper tantrums, I mean, that goes on forever, right? So, you know, it's like, you know, it's when it's extreme or there's just a lot more going on. Any other parents have any thoughts on that? I'm certainly no expert.
It's also the duration, right? I mean, that
Yeah.
stuff can happen for a week, like say you didn't make the basketball team,
Mhm.
and maybe you're throwing temper tantrums for a week and they're a pain at home for a week, but
Yeah,
there's an end to it, so I think kind of the duration is what really makes it a disorder. There's
Sure.
something that needs to be done with.
yeah, definitely the duration and, you know, like with kids, I mean, your pediatricians can be a really good resource for this too, as a starting place. And, you know, pointing you in the right direction. And so I also just want to mention adjustment disorders. Because I think when we talk about mental health, we think, oh, you gotta have something really wrong with you to go and see a therapist, or, you know, like, I don't know, maybe I don't have enough going on that I, you know, that I need to go see a therapist. But how many of us have ever experienced any of the things listed up here? I would imagine everybody. So, and a lot of times we have, you know, we've gone through adjustment disorders where we had to experience big adjustments, and sometimes that comes with some depression, anxiety, all these things. This is normal stuff. Like I said, I've been seeing my therapist for over 10 years. And a lot of that is just kind of like at different times where I had stress that was higher, we saw each other every week. Right now, we're kind of seeing each other every month. So, and it doesn't mean that you have to even be in long-term therapy. Sometimes you can go for just 6 weeks and that's helpful. It doesn't, so I think that just trying to know that it doesn't have to be a whole lot going on that you need to see a therapist. So sometimes just talking to somebody can help. Yeah, just think about all the stress and think about, and it doesn't mean that it even has to be a therapist, right? There are other forms of getting help. Sometimes that's a support group at your church, or, another kind of a grief group, or, just connecting with a friend and say, hey, can we just talk every other week and have coffee every other week? Because I'm going through this thing and I need somebody to talk to. So it can, take the form, all different kinds of forms. So, I'm asking the question, how can I get help? Like I said, it can start a conversation between you and your primary care physician or your pediatrician. I think that's a good starting place. If you definitely want to get therapy and you're ready to make that move, you can also call your insurance company, and they can refer you to a counselor or a psychiatrist that's in your network. Psychology Today is actually a really good resource. You can actually go to their website and you can actually see that a lot of them have videos, so you can actually kind of feel like you know them a little bit. It shares all their expertise, and if there's a counselor that sees people anywhere in North Carolina, and they might be, maybe they live in Western North Carolina, but you can do it virtually because they have that's a really good fit for me. And that's one of the advantages of the virtual therapy these days. And I mean, certainly if you want to see somebody in person, there's definitely options for that. It has, I think they did a study and shown that virtual therapy is just as effective as in person. So again, that kind of expands your options. Or talking to your pastor might be a good place to start. We actually have resources here of somebody who, like Doug and I see people sometimes do some brief counseling, just here through the church. And so if you're going through something, that's maybe just, like I said, brief or an adjustment, and you just want to talk with somebody for a few weeks, we have, pastoral staff here for that. Or, talking to Jill or Newton, and they can kind of suss that out and say, is this something that's going to be brief, or maybe you do need a little bit more intensive therapy? And, we can help you determine that, or, figure it out. And, I think one of the things that also can be overwhelming is trying to figure out, okay, where to start, what kind of treatment. There can, of course, you can get medication sometimes through your primary care physician, which sometimes is a good option for people because psychiatrists are kind of hard to find these days. And so especially if somebody is in therapy and they're able to see their primary care physician just to get a low dose of an antidepressant, I will recommend they do that if they're having trouble connecting to a psychiatrist. Of course, having a psychiatrist is always a great option. There's cognitive behavioral therapy is a lot of what I do. When I see folks and younger kids, occupational therapy might actually be more helpful than talk therapy. And also, or if you're looking at talk therapy, a lot of what they will do, if you're picking younger kids, 4, 5, 6, 7, it might be helpful to just have some play therapy too, which is a lot of what they do. It could be, like I said, brief counseling, peer support. There's all sorts of options. Exposure therapy is one that's particularly helpful for people who have extreme phobias or disorders like OCD, anxiety. I've actually been using that a lot, for anxiety lately. That's been really helpful for folks. There's also for folks who have PTSD, EMDR is a new therapy. Has anybody ever heard of that? Yeah, it's kind of this like tapping and kind of responding to eye movement. And a lot of people swear by it. So that can be a helpful, tool. If any of these, feel like it would be a good fit for you, you can work on finding somebody who treats with specifically this kind of, modalities. Psychosocial rehab has been, when I worked in community mental health, we actually had a psychosocial rehab there. It's really good for people who are just having trouble functioning at all. It gives them a place to go and receive skills. And then, of course, if there's intensive outpatient programs, which can sometimes be helpful if things get severe. Any questions about these types of treatments or experiences with any of these treatments that you found helpful?
What about recreational therapy?
Oh, yeah, tell me more about that.
Well, years ago, I helped start a group for veterans.
Mhm.
There was a group of us that started a nonprofit on how recreational therapy works, because you have a success in recreational therapy,
Mhm.
and then they carried it into how do you reintegrate into yourself,
Oh,
and
okay.
then reintegrate into whatever it is, school, your family, society. And, it was a continual follow-up. It wasn't just the recreational modality by itself.
Hmm,
And recreational wasn't just a sport. It was,
okay.
we had a quilting club that joined, more men joined the quilting than women. It was really cool to see that, and the quilts were amazing. National Geographic did one on masks, and that was part of the recreational therapy. It was one of our groups.
Oh, cool.
Poetry, movies, baking, a whole bunch of different things, but recreational therapy is one because it gets them out of their shell.
Yeah,
It gets them into an environment that they're comfortable with, and then they start talking.
yeah, definitely.
That's a lot like play therapy.
Yeah. Mhm.
So I guess recreational would be the word for adults.
Yeah, well, and sometimes nature.
Yeah, that makes sense, yeah.
Yeah, like specifically around nature.
Well, not just nature, it's-
Yeah.
recreational therapy is an activity.
That like could be knitting or, yeah.
Yeah, any kind of activity, because not everybody wants to go fly fishing
Yeah.
or hiking or
Yeah,
skiing.
exactly, yeah.
Right, so it's an activity.
Cool. I don't know much about that, so thanks for sharing. Yeah. Anything else out of this list you have questions about or want to share any experiences with? Okay, so another piece I want to bring up is how to talk about how to talk to loved ones about getting help. So this can be really tricky, right? If you have a family member who you feel like is in a place where they need some extra support, how can you talk to them? I think it's really key that we take a collaborative approach rather than a confrontational one. It's very easy, especially if it's somebody you're close to, especially if it's a parent or a sibling, to kind of be like, you need to get help now, right? Kind of say that. And the more we push like that, the more likely somebody's gonna be like, no, I don't want to, you're pushing this on me. So really taking a more supportive approach is important. When I say resist the writing reflex is something I refer to as when you're trying to fix it. So you're like, look, I found this program, it's perfect for you, just sign up and go. Or I found a therapist, this is gonna be perfect for you, just go. Try to resist that reflex, and even just in your questions and how you approach that person. Avoid blaming them, give them a chance to share where they are, and avoid imposing judgment. Pause and reflect, try not to push your stuff to the side, and know that they might not be ready. That there might be, when we think about sort of the stages of change and where somebody is, we can't, a lot of times we can't make people do things, right? Unless they're in a place where they're severely gonna hurt themselves or someone else, we can't make anybody, go to therapy or get help. And so know that they might not be ready, but the more you kind of have that conversation, it might open them up to it. So I think maybe if you're so close to them, maybe you're not even the right person to talk to. Maybe it's a supportive friend that might be a better choice, but if it's your spouse or like a sibling or a parent. What to expect in therapy. So this can be kind of an awkward thing, right? You go to your therapist for the first time and you're like, I don't really know how this works. How does this happen? I don't know. So know that it may take some time to build rapport. I know for me, when I see somebody for the first time, there are going to be a lot of questions at first to gather history and including family history, and so it may feel very overwhelming. It's just kind of what we have to do, and I always say, sorry, I know this is a lot of questions. I'm just trying to gather as much information as possible and get to know you. Don't be afraid to ask them questions about their knowledge around specific types of treatments or their style. Ask them how will they help you work on your goals. And it's okay if someone isn't a good fit. Like you can go to a therapist and be like, I don't really think that was a good fit for me. So just have all those things in mind, that they're there to support you, and that it can just take time to build rapport, and also there might be, that it might not be the perfect fit for you. So any other thoughts on going to a therapist for the first time and what that's like? Or?
It can cause anxiety.
For sure. I mean, it's like, I would try to remain as calm as possible just to help them relax. But yeah, it can be anxiety producing, especially I think the hardest part is that there are so many questions and so that I have to ask to kind of gather information. And I don't know about you, but if I'm getting asked a lot of questions, that can be overwhelming. And just having to share your story can be overwhelming. So know that those first sessions especially might be intense. But if you feel like it's somebody you can trust and you can open up to over time, it could be really beneficial. And that's why, like I said, with the psychology today, I like that they have the little videos now. So you can kind of get a little bit of a sense with them, because sometimes you just vibe well better with some people than others, right? And you can kind of get a little sense for them by just watching a video of how they treat folks. The most important thing is there is hope, right? People are resilient, and having a supportive or having a good faith and a supportive faith community or supportive community can go a long way. And so I just included this verse. Though you have made me see troubles, many and bitter, you will restore my life again from the depths of the earth. You will again bring me up. You will increase my honor and comfort me once again. So there's certainly hope. I also included this verse because it just, we all gonna need support at some point or another in our lives. And so there's nothing wrong with asking for help. Just to try to, like, again, the whole purpose of us doing this mental health awareness month is to reduce the stigma and know that it's okay to get help. So come to me, all you who are struggling hard and carrying heavy loads, and I will give you rest. Put on my yoke and learn from me. I'm gentle and humble, and you will find rest for yourselves. My yoke is easy to bear, and my burden is light. And so I think just by the fact that you're here at First Pres and there's a whole staff of people and there's this whole community that's supportive, you're already in a good place where you can get some of that extra care if you need to. So just looking ahead, so we're going to do 3 of these sessions. So next week, there'll be more concrete ways to support your own wellness. Maddie Lohman, who is a PhD in psychology, I believe. She's going to talk about kind of self-compassion and topics around that, offering yourself kindness and grace. And then in 2 weeks, we have Katie Rich, who will be talking about how to practice extending empathy to others. So Yeah, so well, thank you all for joining and thank you for being, on board with this topic and, going out there and to reduce the stigma and, I'm certainly here as a support person. My office is on the second floor. You can always make an appointment with me. Like I said, I see folks here, who just need some kind of brief counseling or I can also refer out. And I do see folks, in the community as well. So know that I'm here as a resource for you and would love to help in any way, so. Yeah, absolutely.
Thanks, Caroline.
Feel free to grab some of the stickers back there, or, Brenda, you get a t-shirt if you want. They're pretty cool t-shirts, I will say. Yeah.